One important role of any university is to conduct research and disseminate major findings appropriately among the key stakeholders and community groups collaborated in research.
MUHAS has three important core functioning: research, training, and services.
More often, healthcare practice and effective prevention efforts based on new research knowledge are not always communicated among key stakeholders, including community groups and policymakers.
Research, being one of an important core functioning of the university, has to be disseminated to the right public. Some kind of research that we conduct supposed to influence the policies and to affect the lives of the people.
In fulfilling that gap, Muhimbili University of Health and Allied Sciences, MUHAS, saw it is worthwhile to initiate a university-wide dissemination as a platform of sharing research findings.
So university-wide dissemination is just one of the several functions or several activities that the Directorate of Research and Publication, which is the custodian of research at the university, is doing. So through the SIDA, Swedish International Cooperation Agency, we receive the funding, a strengthening of our capacity to conduct research, as well as to disseminate research. MUHAS decided to disseminate the findings to the public through this channel, University-wide Dissemination, in order to bring together the researchers at MUHAS, the scientists at MUHAS, the academicians at MUHAS, with their counterparts in the ministry, implementing partners, and everyone who is working address challenges of health of the people in Tanzania. Another important reason was to actually increase the visibility of the university to Tanzania and globally, and to increase the interactions between the scientists within the university and the scientists within Tanzania and their collaborating partners. Another important reason was to address the national health issues. As you well understand that we are conducting research of public health importance in Tanzania, and therefore disseminating these findings can ultimately address the core challenges that the country is having. And the last but not least is actually to influence the policy that is governing addressing challenges of the Tanzanians in Tanzania at the region level and in collaboration with partners at the global level.
The first university-wide dissemination took place on 26th of September 2018 at MUHAS main campus with a theme of comprehensive management of people addicted to heroin, implication for programs and policies. It was a remarkable event which officially launched by the Deputy Minister for Health, Community Development, Gender, Elderly and Children, Honorable Dr. Faustin Ndungulile.
I just want to acknowledge that we have noted the very big achievements. We as government, we are still working together with you. The doors are so open to welcome you to discuss how we can continue to improve the mental health services. The Ministry of Health determined to strengthen and prioritize the mental health services.
Tunazipa kipaumbele kinachostahili. Nadhani wote tunafahamu tafsiri ya swala la afya WHO.
As you all know, definition of health by WHO focus on physical, mental and social well-being.
Utaratibu huu uendelee. Ni jambo jema.
So this event should be continuous effort. We as government, we will give you endless support. So make sure you active involve us in the activity.
One of the interesting parts of the event was a keynote address from Dr. Jesse Mbwambo, a senior researcher with a wide range of experiences on comprehensive management of people addicted to heroin.
When we look at people who use drugs, we look at the extreme and we forget that we need to look at the middle where all the problems start emerging. So we look at the consequences, the bad things that happen, while we have people who are very well preserved as yet, who have issues with their drug using behavior that we need to be addressing ourselves to.
When we talk about comprehensive management of people who
are addicted to heroin. There are two things that we're thinking of. One of them is addiction management, and the other one is comprehensive HIV intervention. When we talk about comprehensive HIV interventions, we're actually using the 10 components coined by WHO, which is 1, opioid agonist therapy, opioid substitution therapy, null syringe exchange, HIV testing and counseling, treating patients if they are HIV positive, hepatitis screening and vaccination if a person is hepatitis B negative, treatment of TB, screening and treatment of TB, management of reproductive health related issues, overdose management, as well as psychosocial interventions. Now, this does not take into account mental health disorders associated with addiction or addiction itself, whereby you have physical treatments as well as psychological treatments and social treatments.
Nimeanza kutumia dawa za kulevya mwaka 1994, nilikuwa nikitumia heroin. Na ilipofika 2009 nilianza kujidunga. I just started using heroin in 1994 and started injecting in 2009. I tried to quit drug for so many times, but I failed. In 2011, I heard about methadone clinic at Muhimbili hospital. I was so impressed and believed that I will recover my health condition because that was my intention. That's why I decided to join the services in 2011 through a Center for Human Rights. On 27th September 2011, I officially started using methadone. The first thing that I'm so happy about is quitting drug, especially heroin. Drug addiction is associated with so many challenges, such as failure to actively engage in socio-economic activities. So since when I started using methadone, I succeeded to maintain good relationship with my family. I did my stuff very well, and now I have rented a room. I wish to get married soon, and I look forward to attaining my long-awaited dream. I have been a student at college pursuing a diploma course. I just quitted, but now I wish to fulfill that dream someday. Dr. Jesse Mbwambo believed that someone can be a drug addict, but he or she might recover and be a productive person. Dr. Jesse Mbwambo is my heroine. She took me from zero, now I am here, I can say.
Kabla ya sijaja kwenye mradi nilikuwa najishughulisha na kazi ya hotelia.
Before I joined the intervention, I have been an hotelier. I worked in the hotels and restaurants almost for 5 years in Zanzibar. Then I got a boyfriend. This is a guy who exposed me to heroin. First, I lost my job after my boss realizing that I use heroin. Second, I had to go back in the street to find best ways on how I can survive. So I had to do illegal business such as sex work in order to attain basic needs and heroin too. After a long period of time, I got drug addicted friends who told me about methadone clinic at Muhimbili. I wasn't sure if I would recover my health conditions because I tried to quit drug for so many times but with no success. So I thank God my health condition now has improved since I joined in the intervention. I'm the person who wasn't before. Over the years ago, I failed to take care of my family. As the drug user, I wasn't care about anyone except myself and the heroin. Finally, I ran away from the family. So, after attending the methadone clinic, my health status is recovered and I managed to re-establish good relationship with my family. I'm very proud for being a mother of 2 kids, but in previous years I didn't want even to see those kids.
The first University Wide Dissemination was so successful and an outstanding event.
The activity was very successful. We could bring together a number of policymakers, including the Deputy Minister of Health, Community Development, Gender, Elderly and Children, Honorable Faustine Ndugulile. Another important success was to see how our research at MUHAS has been able to influence changes in the policy, changes in the implementation, and changes in the lives of the people. For example, establishment of care and treatment facilities for people with addiction, such as methadone clinics at MUHAS, at Temeke, Mwananyamala, and in other big cities that the ministry is actually doing at this point in time.
However, the university-wide dissemination was very successful, but was planned to be a yearly continuous event.
But looking in the future, this kind of event, we hope that they can be absorbed into the university's almanac, as we have just started, for sustainability of this kind of activities. I should take also this opportunity to thank everyone who made this possible, starting with the university management, Professor Andrea Pembe, the Vice Chancellor, Professor Kamuhabwa, the Deputy Vice Chancellor responsible for research, academics and consultancy, the Directorate of Research and Publication, the administrators and the volunteers at the Directorate, and Dr. Jesse Mbwambo and the team that worked tirelessly to make this activity happening, the media people and the rest of the people that attended from the university. I mean the faculty, the students, and the professors. But most importantly, I would like to thank our collaborators for making this happening. There's the Embassy of Sweden, and then the implementing partners such as USAID, Drug Enforcement Agency, and other implementing partners who attended. Last but not least, the Ministry of Health for ensuring that they are with us to make sure that this event is successful. And for the Deputy Minister of Health, Honorable Ndugulile, for making it to the event personally and deliver the speech that we so much needed.
It can be noted that research findings contribute to many advances in medicine and public health initiatives. The findings provide evidence-based information that can inform decision-making process, facilitate change in programs and policies, and help to improve healthcare services and delivery.
Kwa ushauri wangu wazidi kufanya utafiti wakajua.
I advise MUHAS to continue conducting more research so as to identify where our fellow drug users are. Still, there are so many drug users in the streets.
In fact, many people view the appropriate distribution of research findings as an ethical obligation of researchers and research institutions. Therefore, it is very crucial for MUHAS to continue collaborate with stakeholders in doing research and communicate better the research results.